So managing the magnet journey involves so many moving parts that trying to tackle everything at one time is really a recipe for burnout, which is why prioritization and triaging are absolutely so critical. I try to stay focused on three key factors when I'm prioritizing projects. The first one is impact. The second one is alignment with magnet goals. Is it aligned? And the third one really is then feasibility. My first priority is always on the work that has the greatest impact on patient outcomes, because at the end of the day, Magnet is all about improving care. So these projects are really non-negotiable. These could be projects like aiming to reduce hospital-acquired infections or improving patient satisfaction scores, or it could be reducing falls with injury, or maybe it's readmission rates. After patient outcomes, I prioritize projects that support nursing engagement and satisfaction. So some examples of these kinds of projects could be, implementing or improving your professional governance structures. It could be expanding professional development opportunities, or it could be maybe improving nurse retention through mentorship programs or something like flexible scheduling initiatives. The next thing I focus on is projects and stories that are absolutely critical to moving the Magnet document forward. And this could mean things like addressing gaps in practice or organizational structure that really directly align with Magnet criteria and that are going to be needed for document submission. It could be all of the stories that need to be written, polished, and then finalized for document submission. And how are we going to get all of that done? So one of the questions that I always ask myself are, what are the absolute must-haves to keep this document on track? After prioritizing based on impact and alignment, the next factor I look at is feasibility. This is really the anchor that keeps all of those big ideas grounded in reality. It helps you decide whether a project is realistic given your available time, resources, and capacity. I will usually look at a few things. So does this work require significant stakeholder buy-in? Do we have the necessary resources like staffing or budget available? And are there any dependencies or risks that could actually delay progress? So I have found that balancing these three factors, impact, alignment, and feasibility, really help me allocate time and energy strategically. It prevents me from getting burnt out, both myself and the team. It helps keep the team really focused, and it also ensures that every effort really contributes meaningfully to that larger Magnet journey.